So, to talk about the series that we're in, Sheriff Apple was joining me this morning, and he got a phone call, and his wife is positive. So he beat feet out of her, the right thing to do, and going to get tested. So it's here, folks. I don't know how much more we can push this out there in the direction that we're headed. And the direction that we're headed is scaring the hell out of me. And I'm going to get into the numbers, and look, I'm not trying to cause panic. I'm not trying to cause people fear. I'm just asking you to wake up and help us fight this. And if you do your part, we'll get through it. We'll get through it. But we need your help to get through it. So today marks 248 days. 36 weeks since the first case of COVID-19 on March 13th or 12th, excuse me. And, I thought 99 was a high number. I couldn't believe it. And yesterday when we left our offices around 7 o'clock, we're like, what are we going to do? Do we go on? And I said, look, I don't want to go on and just say the same thing. And not unless something out of the ordinary happens. Well, I should have chose my words better. So as of today, there's 147 new positive cases in one day. 147. I thought 99 was bad. When I got that phone call from my deputy, Dan Lynch, last night, and I said, oh boy, what went wrong? He goes, I can give you 147 reasons what went wrong. And it's scary, 147 for one day. So this is easily the highest day we've had since this started in these last 8 months, in these last 36 weeks. I thought Wednesday with the 99, we weren't going to see that number again, and I was hoping that people were going to do the right thing and things were going to go down. But I talked to my colleagues, my county executives, texting last night with a variety of them, and I was talking to Ryan McManus via text out in Syracuse. They have something like 200 for today, and they had 222 was their high. And what's alarming there is they got a population of about 480,000. We got a population of roughly 320, and we're at 147. They're at 200 today. So just to put it in the right point of view, there's an increase of 815 new cases since November 1st. Think about that. 815 new cases since September 1st. It's not just because of increased testing. We're seeing our percent positives creep up too. Hospitalizations and everything else. As of today, there's 4,406 positive cases of the coronavirus in Albany County. 1,733 people under mandatory quarantine. Today, again, sets a record for the highest number we've had under mandatory quarantine since this began. And that's why yesterday we called on for more people to help out with the medical corps, to volunteer, putting more tracers on, because it's just not the Department of Health that's on the front line doing this and doing a great job. Our nursing home staff is working around the clock dealing with it early on when we had COVID-19 patients there, and keeping our facility safe and clean. The jail does a great job, probation, road patrol, health services, children's services, all these things play into a role that we have an obligation to continue services going forward. We got to be smart about it, but we have to protect our workers, but still continuing that core mission of moving forward. Of the new positives for today, we also know that 80 of them have had close contact to a positive case. 9 healthcare workers, and then we've had 4 people that reported traveling out of state. And here's the other alarming thing, and I don't know how many times I got to keep saying this. 54 people don't have a clear source of infection. They magically will not tell us. They all said I was home doing nothing. It doesn't help us stop the spread. We are there, people. We're in a second wave, and our numbers are only going to continue to go up. I hope they go down. I hope they go down. I hope our hospitalization goes down, but we need your help to do your job. If you get it, you just got to let us know who you're in contact with so we know the exposure level, and we'll get through it. 54 cases is just too high to have people say they don't know and they had no contact. I find it hard to believe 54 people didn't go out, didn't go to work, didn't go to the store, and didn't go anywhere. You're not doing us any favors. Help us save lives. Help us stop the spread. Help us do our job. That's all I want from you, please. So 18,719 people have now completed quarantine. 3,810 tested positive for the virus, and 57 have recovered as of yesterday. There were 5 new hospitalizations overnight. There are now 38 people currently in the hospital. That's the highest it's been since the 28th of April. Since the 28th of April. So please keep that in mind. Our hospitals are now getting packed. I think you've seen the stories on the different news outlets. Hospitals up north, out west, they're getting back to capacity. The hospitalization rate as of today is 0.86% of those who've tested positive. Yesterday, it was at 0.82%. 9 patients currently in the ICU yesterday. And that number, or excuse me, there's 9 today. Yesterday it was 8, so we went up 1 person in the ICU. The last time our ICU number was this high was the 30th of April. Over the last 5 days, there's been an average of 92.4 new positive cases each day. Yesterday it was 70.8. Our 5-day average has hit an all-time high since this began 8 months ago. Among the positive cases for today, 47 been associated with the University at Albany, which I do want to thank President Javier Rodriguez and his staff and the facility staff and everyone that works up there. They were doing a good job, but it's hard, and they're trying to stay on top of it, and they were. For a while, we stopped reporting the numbers because it dropped so low it didn't really matter. But today, 1/3 of all of our positive cases, and yesterday about 1 out of every 7 cases were tracked back to the University of Albany. And that day before that, about 1 out of every 4. So again, luckily we have great leadership at the University of Albany and a great chancellor, Jim Malatras, that's on top of this and making sure that they're trying to curve it and shut things down. And you know the steps that they made up at the University of Albany. So I'm hoping everything that they're doing there will get our overall numbers down. But we have to address the spread of the virus among people who aren't students as we're mapping and tracing. And you can download that app, if you have an Apple phone, and it will show you a variety of things. You walk by people. It was a good app the governor's office put out or put together, and shows you the rolling average and everything else. So please, if you have an iPhone, grab the app. I think I have it. I do have it on my phone, but it's the COVID Alert New York. It's very simple to get, very easy to download, and it gets into the percentages and everything else and the positive cases and where we're at. So we're trying to educate people, not scare you, and that's why we had that PPE press conference yesterday with Matt Peters and Andrew Joyce and then Wanda Willingham and Lynn Lakakis and Mayor Sheen and Sheriff Apple and the rest of the people that are there and the business owners to help the business owners. And I'm not advocating for shutting down. If you see the matrix talks about what steps, zones you go into, and how you end up in the zone and what the different restrictions are in them zones. We need your help. 147 people, and without you doing the right thing, can we contribute this? I was talking to my other county executives across the state. Can we contribute this to Halloween? It's in that right time frame. And all the numbers went up. But it's just not here in the state of New York. It's all over. That's why I talked about other parts of the state. We talked about the world. This seems to be hitting everyone at the same time, and that's the information we can't figure out why. And we have to be concerned. You have to be concerned. Be smart. Look at the CDC guidelines about places to avoid. You go to parks, I reckon, it's great to go see the state parks, but stay out of the bathroom. Stay away from the high visibility places that everyone goes to. Stay away from the crowds. If you love to run, don't run with crowds because the particles stay up in the air and you'll run into them, or run with your mask. There's a lot of guidelines. I know the world's different. I know we have to reimagine the workforce. We have to reimagine how we interact as a society. But we can only do this if we do it together. And we're not going to get through it if we just keep relaxing the standards or thinking it doesn't affect me. I have no signs or symptoms, or them 20 to 29-year-old kids that are the highest rate number since this has started and continue to grow leaps and bounds, continue to go out and do the wrong things. I had Sheriff Apple here. We were going to talk about enforcement going forward, working, as I said yesterday, the October 6th sanitation code that the governor put out gives the authority to fine businesses in places up to $15,000, $10,000, and $5,000. After last night, seeing the numbers we did, I circled back with Sheriff Apple, and we talked about working with the towns and villages to help with the enforcement. You shouldn't walk into Walmart's, Target, Sam's Club, any place now, any restaurant, and see a worker without a mask on, someone walking around. They have people doing it, but they do need your help. And I will make this very clear when I say this. If someone if you tell someone, wear your mask, take it off your chin, it's not a chin strap, you're not playing football, put it up on your nose, I will say this to you. If they get confrontational, just walk away, because it's not worth it. It's not worth the argument. Some people just believe it's not there or it's not affecting them, and they're just going to walk away. We need your help. We really, really need your help. And I'm saying this to everyone watching this or listening to it. Please, please help us, because the direction we're headed in is worse than 8 months ago, and I didn't think it could get any worse. I was hoping when the second wave came, we would have treatment for the virus, and that's not looking to get us to about April, and then you have to get it out to everyone. So just do the math. If it comes out in April, you're probably looking to September of next year to everyone being vaccinated, and probably later than that. So they are correct. We might be this way all through 2021. And it's hard mentally and physically, and not just for adults, for children, which I said yesterday. But if you need to get tested, please go to our website, albanycounty.com. We have a lot of available testing now in the county, and we don't charge you if you can't pay, and UAlbany is free. But please schedule an appointment with the University of Albany at 1-888-364-3065. Our Whitney Young testing site is also available for kids, 518-465-4771. Other testing sites, CVS, Walgreens, Rite Aid, Albany Med, Priority One Urgent Care, Central Med Urgent Care. I could go on and on and on. And please help us. Go out and get tested. Stay home. Do the right thing. Wear your mask properly. Cough into your arm. Clean your hands. And try to stay 6 feet apart. That's the only way we're going to continue to get through this, with your help and your dedication of making sure that we get that. Please do the right thing. I want to share one thing with you. Mayor Charles Pacicelli sent me a COVID-19 sign that he put up, reminding people to wear masks and socially distance. Mayor, thank you. It's kind of neat. So just want to show that sign that he put up and let them know. So he's been sharing that with businesses throughout Waterville and to remind people. And I know that's a situation we're in. Please, we got to stay vigilant, and we got to stay on top of this and continue to move forward. I also want to remind people we have the drop-off for Toys for Tots today at the Albany County Hockey Facility next to the airport from 11 a.m. to 4, and that you can get a $10 gift card and donuts for doing that. And one of the other things I want to just remind everyone too is that, look, we have to have some type of normalcy going forward. I get it. I know people want to interact with one another. We can, but you have to be smart about it. Just to give you an idea, a rolling average of positive cases as of today is 2.2%. November 11th, it was 3%. November 10th, it was 1.2. November 9th, it was 5.4. 4.7 the 8th, and November 7th at 0.87, and November 6th at 2.7. Our 7-day average has been 2.86%. To get into the yellow zones, 3%. If there's questions, I'll have my deputy Dan Lynch talk about it. This is what we're going to talk about on Monday, because I didn't think I'd be here today. I really didn't. So, again, not trying to scare people, just be smart. Be smart. And if you need to take a break, take today off. Relax. Re-energize your batteries and realize we're in this for a couple more months, if not a little bit longer. Our mental health support's always available 7 days a week from 8 a.m. to 5 p.m., 518-269-6634. It's just not for adults. Children can call, parents can call with children. And if we can't handle that situation, we will make sure you get to the person that you need. 24-hour sexual assault hotline, 518-447-7716. Our 211 number with United Way and the New York State hotline, as always. And please, people, just remember, 147 today. I'm hoping our numbers aren't like this tomorrow, the next couple of days. Please, it's there. If you stay home, don't go out. I'm not advocating. I want to make this clear. Not advocating for a lockdown. I don't think we can go there again. It took its toll on addiction. It took its toll on mental health people, suicides. I could just go on and on and on. Help us not get there. If you don't want to get there and we go through these different zones, I don't want to get into that either. I was talking to Steve Newhouse in Orange County that went through them. They're difficult, they're hard to figure out, and there's a lot of education you have to do, not just with us and government, but with businesses and schools. And we'll talk about the school district on Monday, because we're rolling out a bunch of stuff with that, and I know the superintendent put a little out on that today, but it's meant on Monday, because we're just trying to figure it out. And everything changes. You know, we get marching orders, and then we got to figure it out, and then we got to figure out how we're going to enforce it, how we're going to do it. And as we said yesterday, our people are tired. We've been in this. A lot of people haven't had a lot of time off to re-energize, and we're getting fatigued from just working around the clock and still being in this. So we need everyone to roll up your sleeves and do the right thing.
A couple points to the county executive's remarks. Nationally, I believe the number yesterday was the report of over 190,000 positive COVID-19 cases. We go to the state, they reported in excess of 5,000, which is the highest report since sometime in April. And then since November 1st to present, we have 18.5% of our total positives have occurred in that window. So the second wave, as the county executive has mentioned for the last couple weeks now, is here. We need to be, we need to double down and be as vigilant as we ever have and work together to get this done and flatten the curve. And November 2nd, I just want to touch on something in regards to our workforce. On November 2nd, the county had a department head meeting and reenacted our continuity of operations plans. What we're doing is going to staggered shifts, alternative work schedules, allowing employees to work remotely if the job responsibilities allow a remote work. And we're encouraging and have been encouraging our local partners and municipalities to do the same, and for business owners around the county to do the same, if it permits. We're doing our part. We hope that you'll do your part and really go back to flattening the curve, working together to move out of this second phase and hopefully in brighter days in the future. So I just wanted to touch on that. Our workforce has been extremely flexible. We have worked with them in providing technology that permits additional work staff that would not have access to work remote back in the spring, that technological abilities to do so now. So we're moving in the right direction. We would encourage everyone to follow suit. We have a meeting scheduled this coming Tuesday with our local leadership within the municipalities to forward on that message, and hopefully they will join on board. And my last comment I just want to make, and the county executive has mentioned this, we have so much testing available in the community now. That was not the case back in March and April, and we've made so much headway in providing opportunities for the community to receive and go and get tested. I really would encourage everyone to do so now. If we enter into the clusters, the state is going to come in and do a really aggressive testing for zones that they determine to be necessary and the root cause of spread and transmission. Let's do it before we get to that point. Go to one of those sites, get tested, get your family tested, give our local health department a real sense of what our community looks like and whether or not there is viral transmission and spread that's getting out of control. We don't want to enter into those clusters, into those phases. Now is the opportunity to double down and use all the guidelines that have been in place for a number of months, but also go to that next step and get a test. That will be a true indicator of where we stand as a community. We have the ability, we have the options out there. Take advantage of it, please.